Hello, my name is Khaleva, and I'm a research fellow at the University of Southampton. During the last 2 years, the EAACI task force, led by Professor Graham Roberts, have been working on the development of the guideline on effective transition of adolescents and young adults with allergy and asthma. As there are no international or European accepted guidelines available for healthcare professionals working in this field, so in order to develop best transitional practices across Europe, it is first necessary to understand current transitional care and access to specific healthcare resources across Europe. So, we invited healthcare professionals working with adolescents and young adults with allergy and asthma to participate in the survey. It was conducted in June 2019 and disseminated through EAACI and national allergy societies. Questions were developed by the EAACI Adolescent and Young Adult Task Force and translated and back-translated into multiple European languages. With your active participation, we received almost 1,200 responses. Most of them were from doctors working in the tertiary settings. All EAACI sections were well represented, and healthcare professionals were predominantly involved in asthma in pediatric sections. Apart from that, responders had a wide spread in the years of practice. We looked at the age when the transition process is usually started in Europe. Some of you started 10 years, but the majority at 16 to 18 years. What is interesting is that adult and healthcare professionals who see all ages mostly don't have a transition process in place, which is also reflected in the comments. However, transition is a holistic process, looking after every aspect of growing up, such as medical, psychological, and educational needs. So it is not only about physical movement from pediatric medical services to adult-oriented care. Survey shows that most of you transfer patients at a specific age, which is about 18 years. So, how they transitioned? There is a quite wide spread of different practices, and most healthcare professionals don't have any process set up in clinic. Patients are mostly transferred at a specific age, and some of you are using a checklist of questions. However, it is useful to use it throughout the transition process in order to identify which areas of the adolescent and young adult self-management and well-being need to be addressed and improved before transfer. There are different ways of communication between pediatric and adult services in order to provide a smooth transition and prevent loss of follow-up. But most healthcare professionals in Europe don't do so, and only some of you have regular meetings and joint consultations. Is there any help out there that healthcare professionals in Europe are using? The vast majority are not using any specific resources in clinic. Only 13% have a transition guideline, and a quarter of you seeing adolescents on their own. It is important, as these patients need to shift from pediatric healthcare, which is more family-centered care, to adult care, where they need to be independent. They need to know what to do, how to manage their disease, and discuss it with their doctor. Again, it also applies when the patient stays in the same department. We talked about resources, how adolescents and young adults can be transitioned. But how many of us actually had a specific training on how to do it right? Based on the results, almost 80% didn't have this training. And it also reflected in the comments. Such as never heard of it before. Doctors don't have specific training in adolescent medicine. A lot of areas mentioned on the figure could be interconnected with allergies. And since most of you didn't have any training in adolescent medicine, do we actually ask the right questions? Each of these areas were rated from never routinely ask to always ask about it. It is represented in the light blue to darker blue. Unfortunately, possibly due to lack of training and lack of time during consultations, we are not doing so. Is transition an important area for us? Yes, and the results of the survey say it is, as you can see from some of the quotes. It's vitally important and should be addressed. It should be widely available. To conclude, this survey demonstrates significant limitations and variations in the delivery of transition practices for adolescents and young adults with allergies and asthma in Europe. These findings have been used in the development of the European guideline in order to facilitate effective transition, improve well-being and healthcare outcomes of these patients. For further information, please watch other videos about different projects within the task force. If you have any questions, please don't hesitate to contact me or any member of the task force. Thank you very much for your interest.